Addyi is a medication containing flibanserin and is designed to treat hypoactive sexual desire disorder in premenopausal women. HSDD is characterized by persistent lack of sexual desire that causes distress or interpersonal difficulty. It is not due to other medical or psychiatric conditions, relationship problems, or the effects of medication. Active substance flibanserin. Indications. Addyi is indicated for the treatment of acquired generalized hypoactive sexual desire disorder in premenopausal women. How to use. Addyi is taken orally, usually once daily at bedtime. The recommended dosage is 500 mg once daily. Contraindications. Addyi should not be used in the following cases: hypersensitivity or allergy to flibanserin or other the product's components, alcohol consumption due to the risk of severe hypertension and syncope, chronic liver disease or hepatic impairment. Special instructions. Avoid alcohol consumption while taking Addyi, as it can lead to severe hypertension, low blood pressure, and loss of consciousness. Discontinue treatment if there is no improvement in sexual desire and associated distress after 8 weeks. Inform a healthcare provider about all medications you are taking, including herbal supplements. Side effects. Common side effects of Addyi may include dizziness, somnolence, sleepiness, nausea, fatigue. Serious side effects are rare but may include hypertension, syncope, fainting, and central nervous system depression when combined with alcohol. If you experience severe side effects or symptoms of an allergic reaction, such as difficulty breathing or swelling of the face, seek immediate medical attention. Addyi is prescribed under strict conditions due to its potential interactions and side effects. It's important to follow the specific instructions provided by a healthcare provider and inform them of any existing medical conditions or medications you are taking. Always consult with a healthcare provider before starting or discontinuing any medication.